Hi everyone, I'm Audrey and today we'll be learning about how to mix insulin. So our objectives today are to understand what insulin is, why we need them, and how to actually mix them together. So let's begin with what insulin is. Insulin is a hormone produced by our pancreas which helps with allowing our body use glucose for energy. So there are some cases when people don't have enough insulin or they're just unable to produce them. This is called hyperglycemia. And hyperglycemia is when your blood sugar levels are too high, and this is bad because then your blood vessels can get damaged and ultimately increase your risk for multiple diseases. This is especially common with people who have diabetes, so we would actually give them a shot of insulin so they can have a normal range of blood sugar levels. And this is why it's important for us as nurses to know what insulin is, because we will have a lot of patients who are diabetic and who have hyperglycemia. So now we know what insulin is and why we need them, but why go out of our way mixing two together? So there are a few reasons. One, it allows us to have greater control over blood sugar levels, and two, it just decreases the amount of injections we would need to give, because why give 2 injections when you're allowed to give just 1, right? So there are 4 types of insulins. We have rapid acting, regular or short acting, intermediate acting, and long acting. So we would need to mix insulins that are compatible with each other, like the clear insulins with the cloudy insulins. But let's also keep in mind that we can't actually mix the long acting insulin with anything, because this could change how the insulin works and give us unpredictable or poor blood sugar levels. So you just heard me mention it a second ago, but I did say that we would need to mix the clear insulin with the cloudy insulin. So what if I told you that there's actually a specific order that we do this? We do clear first before cloudy. And we do this so we can prevent contaminating the clear vial with the cloudy solution. And this is an important thing that we need to remember. So to help you remember, just think of the abbreviation RN. So everyone knows what an RN is, registered nurse, but you can also see it as R, meaning regular for clear, and N, meaning NPH for cloudy. So now we know what insulin is and why we need them. Now let's go ahead and learn how to actually mix them together. So today our patient is Mr. Bennett. We have his MAR and his doctor's order. So we're just gonna make sure that his name is on there as well as his room number. Okay, so let's go on to the MAR. It says here that he needs to take his regular insulin as well as his NPH insulin. We're just gonna compare it with the doctor's orders. So regular insulin 10 units sub-Q, and NPH insulin 12 units sub-Q. We're also gonna check where he last got his insulin shot, because it's recommended that we rotate the sites. So this can be the arms, thighs, abdomen, and the buttocks. Okay, and we're also gonna check for any allergies and lab works if necessary. Okay, so that's everything. Now we are just going to do our hand hygiene. And we're also going to put on gloves. Okay, so we would assemble his equipment. Okay, so I have his equipment ready. Before we begin, we're just going to double check the packaging, make sure there's no tears, make sure that we have the right kind of syringe. So it says here insulin syringe. Just double check with any expiration dates for both the vials. Okay, so we have his vials here with us. We're gonna do our first check. So we would get his MAR and compare the vials with the written medication. So we have here the regular insulin. So regular insulin, we'll be giving him 10 units. Okay, and as well as the cloudy NPH insulin. So NPH insulin, okay, we'd be giving him 12 units. Okay, So let's begin with preparing our medication. So first we're gonna do is we're gonna take our cloudy insulin. Since there are some like remnants on the bottom, we're actually gonna take it and we're going to roll it just so it can be properly mixed. So we're not gonna shake it because this can cause air bubbles. So we're just gonna take it and just roll it until mixed. Okay. So now we're just gonna remove the cap. And we're gonna wipe the top with an alcohol swab. So we're just gonna let this dry. Okay. And while we let it fully dry, we're gonna go ahead and prepare our syringe. So so make sure not to accidentally poke yourself while you're holding this. Okay, so we're gonna do the cloudy air first. We're just gonna administer, so we're administering 12 units of NPH. Also make sure that we do our calculations properly. So since we're doing 10 units of regular insulin and 12 units of NPH insulin, that means that we would be overall giving 22 units of insulin. Okay, so first we're just gonna get the air of the cloudy insulin. So we're gonna take 12 units. Okay. Now we get our cloudy insulin first. Make sure not to let the tip of the syringe touch the vial. Okay, we're gonna put the air in, remove, and put in 10 units of air for the clear insulin. Okay, 10 units. Take our clear vial and force the air in. But this time, instead of removing it, we're actually gonna take our 10 units of clear insulin. Okay. And if you have any air bubbles, you can tap the syringe. Okay. And now what we're gonna do is we're gonna get the cloudy insulin. So here we're gonna make sure that we don't accidentally push the syringe because there's already clear insulin inside. So we don't want to contaminate the cloudy insulin with the clear. Okay. So we did our calculations earlier. We should take 22 units overall. Okay, 22 units. Perfect. Okay, and that is how you would mix the insulins. So if you would need it right away, you can do your second check and give it to your patient and do your third check. But if you don't need it right away, then you can just put the cap back on. Okay, we're gonna make sure we use only one hand here. It would be easier if we had a wall with us. Okay, so you can put you can put the cap back on and put a medication label with the medication, the dose, how many clear insulin and cloudy insulin that you put in, and yeah, and also you would do your second check after you write the medication label, so you compare the medication label with the MAR. Okay, so that's everything you need to know about mixing insulins. Always make sure that you do clear first before cloudy. Make sure that your final dose is accurate and that you maintain an aseptic technique. Also, one thing that you can remember is the peak times for both of the insulins. So Humulin R is 2 hours and Humulin N is 8 hours. So that's when the patient's at most risk for hypoglycemia. So this is when we would closely assess them to make sure that they have normal blood sugar levels. And thanks for watching.